Good afternoon. Thank you all for coming today. We're really excited to see this room filled with people who are interested in working to help eradicate malaria. So we have been asked not to start the program until everyone has been seated. So if you have not yet found your seat, please do so. And we would also ask, it would be wonderful if you would all silence your cell phones. We would appreciate that. And I want to welcome everybody here to Houston today. It is, as I said, really great to see so many of you who are interested in helping join the fight against malaria. For those of you who are joining us virtually, welcome. We are happy to have you at Malaria Partners International's breakout session entitled Freedom from Malaria, Creating Healthcare Equity. This program is being simulcast in both English and French, and it is an interactive session. So you will see a QR code that will allow you to join the conversation. You'll see some questions, and we would really love to hear to see responses from everyone who's in the room and everyone who is joining us virtually. My name is Jenny Andrews, and I am the Executive Director of Malaria Partners International. I'm also a longtime Rotarian in District 5030 and a member of the Rotary Club of Bellevue Breakfast. I'm really honored to be on stage today with our panelists as we discuss malaria and how Rotarians are getting involved in the fight to end this disease that is one of the deadliest known to humankind. Before I begin, I want to tell you a little bit about the organization that I represent. Malaria Partners International is an organization founded by and run by Rotarians. And we work every single day to ignite a Rotarian campaign to help end malaria worldwide. We're sort of patterning what we do after the incredible work that Rotary has done for many, many years now to help end polio. We work very closely with a group of wonderful global health leaders as our partners. Many of them are in the room today, including the Gates Foundation, the United Nations Foundation, and United to Beat Malaria. The World Vision is here, and several other organizations, President's Malaria Initiative, and many others that we partner very closely with. In addition, Malaria Partners International also runs a small grant program. So if your Rotary Club is interested in getting involved in a project to help end malaria in your community or to partner with another club from another part of the world to end malaria, please definitely check out our small grant program. I would now like to introduce a standout leader in the malaria elimination effort. This is Ken Mugisha. Ken has been a member of the Rotary Club of Muyenga for 27 years. He is a past district governor for District 9211, which covers his home country of Uganda as well as Tanzania. He has more Rotary credentials than probably most people in this room. He has served as the District International Service Chair, a District Rotary Foundation Chair, and the Rotary Coordinator for Zone 22. In his spare time, Ken also chairs the board of one of our affiliate organizations, Malaria Partners Uganda, and is also the chair of Malaria Free Uganda under the auspices of the Ministry of Health. So please help me welcome a true malaria warrior, Ken Mugisha.
Thank you very much, Jenny Andrews, the Executive Director of Malaria Partners International. Fellow Rotarians, our friends and colleagues, you have just heard what we do in the fight against malaria, and reports from the World Health Organization show that in 2020 we had 241 million cases of malaria worldwide. Out of that, 95% of the 241 comes from sub-Saharan Africa. 96% of the death of over 620 or 41,000 deaths during that year, you can see came from sub-Saharan Africa. Today we join friends, leaders in discussing on how we can look at elimination using a drive in Africa, which is Africa being malaria-free by the year 2030. We have panelists coming from different organizations, the philanthropists, but at the same time we have champions in Rotary. Allow me to start by introducing one of the panelists, and that is Lady Rose. Lady Roslyn Morautu is the Vice Chair of the Global Fund to fight AIDS, tuberculosis, and malaria. She has a long association with the Global Fund, having served as alternate board member for the Western Pacific region constituency and as the chair of the Papua New Guinea country coordinating mechanism. From her time also as the First Lady of the Papua New Guinea, if you can give her a very big round of applause. She has steadily championed health, HIV programs, and gender issues. Lady Roslyn has worked in Papua New Guinea for the National Planning Office, the Department of Finance and Treasury, and in the private sector, both as a management and consultant and running several businesses. Please join me in welcoming Lady Rose. Our second panelist is Abigail Pratt, and we have said that she's an African in a white skin. She's indeed a sister to Africans, and she spends most of her time traveling all the way between her role as the person in charge of administration at Bill and Melinda Foundation, spending a lot of her time traveling and traversing in all African countries. And this evening, she's flying out after this session to be in Nairobi. So if you see her tomorrow morning addressing in Nairobi, it won't be a ghost. It will be Abigail. She is the program officer, Global Health at Melinda, Bill and Melinda Gates Foundation. Abigail supports strategic partnerships and country engagement initiative, which includes a delivery-focused portfolio, including operational research, chemo prevention, and case management across the public, private, and community sectors. Let's join our hands together to welcome Abigail. Our last panelist is none other than Olayinka Hakeem Babalola. He comes from Nigeria, and he started his Rotary life as a road tractor in 1983 and spent 10 years serving as a Rotractor before becoming a member of the Rotary Club of Amadi, Port Harcourt, Nigeria. He was the Rotary International Vice President for the year 2019-2020. Yinka started as a director, and he is still a director of Sea Blood Africa Project and a member of Board of Trustees of Shelter UK. He is currently a vice chair of the Rotary Foundation End Polio Now Countdown Committee and a member of the Peace and Major Gift Initiative. He is married to past President Pressy, and they are both members of the Arch Clamp Society, having donated to the Rotary Foundation over $250,000 to do good to the people in this world. Join me in welcoming our leader, and this being an engagement about how we can eliminate malaria, the way we're having a drive of eliminating polio by the year 2026 under this campaign called End Polio Now, but also delivering on a promise, which is starting in the year 2022 to run us through 2026. Let's join our hands together to receive past Rotary International Director and past Rotary Vice President Yinka Babalola. So let me start with a question to Yinka to share with us your perspective on the impact of malaria on the health equity in Africa. Nigeria being one of the countries where malaria is most endemic, and being a country with over 200 people as a population, he is the right person to share, and being the first person on the panel, because the problem is mainly on the African continent.
Well, thank you very much, Ken, and good afternoon, my dear friends. I was going to say there are no mosquitoes in this room, so. Yes, if you listen to the set of data that Ken reeled out, 241 million malaria cases, about 630,000 deaths. And then you look at that and you find out that about 89 to 90% of those deaths were from the African continent. In fact, from that part of the world we call the WHO Africa region. So when we talk about equity, there are two things I would want to call your attention to. First is, malaria has been eradicated in many parts of the world, particularly the one we call the developed. If we are talking equity, we should be asking ourselves the question, why are we now talking about 20, what year did we mention, Ken?
41 million.
20, I mean the year to eradicate here in Africa. We're looking at 2030. Why are we talking 2030 now, when it's been done long ago elsewhere? And so you can see the inequity or the equity question there in the first instance. The question is, when we look at what you need to do to stop people interacting with the vector, for example, or the interventions that are required, you find out that the poorer countries are, the more difficult it is to have access to some of those. Let's take research, for example. There are probably a lot of research going on, but the poorer countries probably can't even afford some of that. So they are disadvantaged, let me put it that way. Then if you come to, yes, people do get encountered with malaria vectors, and unfortunately,
Could you use the microphone before?
okay. Can you hear me now? Thank you. So even when people get in contact with the vector, as it were, the malaria vector. Unfortunately, the vector that is predominant in Africa is one that is considered very, very efficient. You know, it does its work very, very well, unfortunately. You know, but even at the point of intervention, all the possible things we need to do. Yes, people get in contact with it, and there are treatments, there are interventions available, but you also find out that there's a lot of lack of equity in that also. The poorer the country is, the more difficult the access, so to speak. And even within a particular group of people within the same country, you know, the poorer people are within that, the more difficult it is to also have access. So while there is evidence to show that between the rich or the well-to-do and the very poor, the incidence of fever is not particularly much marked. But when people get in contact, how do they respond to it? And there's a lot of inequity lack of equity in that also. The poorer you are, the more difficult it is to be able to test, the more difficult it is to be able to have access to the right care, you know. And not too long ago, I just discussed with my sister from the Bill and Melinda Gates, and I said, look, I had this conversation with somebody from the Economic Community of West African States, from the UN, and he says, even when you look at manufacturing of the interventions, you know, the cost of logistic, of moving it from the source of production to where it is needed, is not the same. So the richer countries, the bigger countries, for example, are able to use their numbers and get prices down. But the smaller countries and the poorer countries are unable to do that. So unfortunately, those who are poorer, those who are more exposed, are the ones who are likely to be paying more for the intervention. And I think those are the questions around equity that we need to deal with.
Thank you very much, past Rotary International Director Yinka. During COVID, we had an increase of cases in malaria, and part of the adverts we were running in Uganda, where I come from, was a campaign telling communities that the mosquito was not under quarantine. And yet for us, we are quarantined, but it continued creating havoc in our homes, and that sound of a mosquito in your house can make you have sleepless nights. Lady Rose, when we talk about malaria, there are many international efforts underway, which takes a lot of financial resources. Can you share with us what the current funding landscape looks like globally, and how much funding is needed to tackle the problem from the Global Fund perspective?
Thank you, Ken. Good afternoon, everybody. Good afternoon. And thank you very much for coming to this important session. The Global Fund was established 20 years ago to fight the 3 diseases that killed more people than any others, and they were HIV, TB, and malaria. And that's still the case, apart, of course, from COVID that entered our lives a couple of years ago. We've spent $16 billion since we were established 20 years ago on malaria, and we provide 56% of all international financing for malaria programs in over 100 countries. The way the Global Fund works, looking at the equity question that Yinka was just talking about, is that allocation of money is based on the burden of disease in a particular country and the economic capacity of the country to pay for health programs. So it's set up in a way that the poorest countries with the greatest burden of disease are the ones who get most money. And so, for example, Nigeria is a huge portfolio for the Global Fund, and Africa itself receives 70% of all the resources of the Global Fund. So about 40% of the $4 billion we spend each year goes to malaria. But this is not nearly enough. It's not nearly enough. We've estimated that currently all donors are spending about $3 billion on malaria, but this needs to increase to over $9 billion by 2025 and to over $10 billion by 2030 if we are to eliminate malaria by 2030.
Thank you. Under the African Leaders Malaria Alliance, all African leaders agreed by committing to have different chapters set up in their respective countries to have zero malaria by the year 2030. The chapter in Uganda has received funding from the Global Fund, $200,000 to set up that chapter in Uganda and to pay salaries for the staff for the first 2 years, and they'll continue committing as long as there's proper accountability, which is very key, because those of you from Uganda, there are so many, you remember there was a time when a lot of resources were put to waste, and so many people were in charge were put behind bars because of that lost donation, which was meant to save lives. Now, understanding the landscape from Lady Rose, Abigail, can you share with us the role of the Gates Foundation in investing in malaria as the largest private foundation in the world?
Absolutely. Thank you very, very much. Thank you all for having me. My mom asked me if I was nervous about coming to speak to you all today, and I said, no, I'm not nervous. The Rotarians are literally the nicest people on earth, so I can't think of a better audience. So thank you all very, very much for being here to hear about malaria. There was a real call to action at the Gates Foundation around about the same time that the Global Fund was looking at those three large diseases, malaria being the focus. And in 2007, Melinda French Gates got up in front of a room of malaria experts, malariologists, and said, anything less than eradication is accepting malaria. It's making peace with malaria, and it's suggesting that rich countries are saying that we don't care about malaria because we don't have it here in our home countries. And this is unacceptable. Unacceptable then, unacceptable today. Bill Gates Sr. was also a staunch advocate and a dearly devoted and beloved Rotarian, and he also wanted to put the call to action to Rotarians as well to be thinking about what they can do for malaria. And I can't repeat the number enough. 627,000 lives. It's not just a number, these are lives that are lost every single year. They are women, they are children, and we need to do better, and we need you all. So the Gates Foundation invests in a number of ways. We are heavily involved in the development of new drugs and new insecticides and new diagnostics. We invest very heavily in systems, so whether that's new ways of generating data that can help inform our decisions, whether that is new tools around molecular surveillance, and then the area that, well, I'm most proud of, it's my favorite because it's the one I work on, it's strategic partnerships and country engagement. And the reason that I'm here to speak to you all today is because Rotary is absolutely a strategic partner. And there are friends here from President's Malaria Initiative, and there are friends here from the Global Fund and World Vision, and we all need to think about the ways that we can play to our comparative strengths to solve this problem. In terms of country engagement, and that's the reason I have my suitcase there and I'm hopping on a plane after this session, but it's really working with national programs, with ministries of health to make sure that they are 100% in the driver's seat to solve this problem, and that they have the data available to make good decisions and to use the scarce resources. We've just heard from Lady Roz that resources aren't endless. I had the great pleasure of actually traveling to Zambia just a couple of weeks ago with a marvelous team from Malaria Partners International, many of whom are here today. And we went to look at a project in which we are co-investing. It's Partners for a Malaria-Free Zambia. And it's the first program of scale. And if anyone wants to hear more about it, you should go to the session tomorrow at 1:30 in room 360 Bravo. That's just a gentle plug to go hear more about this project. But it's an absolutely essential one because it looks at community health worker programs. I mean, I see, or I at least saw the Menti a moment ago, where it says that like 64% of you have actually known people who've experienced malaria. So you understand that early access and care is absolutely essential. So this project's really looking at ensuring that community health workers are trained, that they have the commodities, they have the ACTs and RDTs to treat malaria and to report on it. It's a fantastic project, and I think the most exciting part about it was just seeing the energy and the community engagement that the Rotarians bring to this particular type of work. So I think that suffice it to say there's a lot of investment in the upstream research and development, but one of the real focuses of our work is making sure that partnerships are in place to ensure that we are reaching the unreached and we're really reaching last mile folks who are living with malaria day to day. Thank you.
Thank you very much, Abigail. Rotary talking about partnerships. Bill and Melinda Foundation has been of great help in promoting partnerships in Rotary. The first project of scale, which is a malaria project in Zambia, and I'm glad that Martha Lungu is here, the executive director who runs that program in Zambia. $6 million has been committed, and $2 million comes from Bill and Melinda Foundation. Mm-hmm. And just to put you at the forefront of knowing what is happening, when we talk about the deaths, the 227,000 in 2020, over 80% of those were children who never saw their fifth birthday, which means they never lived for 5 years. We need to save the children of the world. We believe we're having our next partnership with Bill and Melinda Foundation and World Vision, with Rotary International, a project and a program which is going to run in Uganda, worth $1.2 million, with a commitment of $400,000 from Bill and Melinda Foundation, World Vision $400,000, and $400 coming from Rotary clubs, districts all over the world, and Rotary International. Now the next question goes to each and every one of you. Can be free to answer. Whoever feels has the best answer should come in first. I'll not dictate. And it says, how and why has progress against malaria leveled in recent years, even prior to the pandemic? How and why?
I won't talk about the finances, I'll leave that to Lady Ross, but I can talk about some of the challenges that we've faced with malaria as a species and as a sort of wily enemy. There is this incredible evolutionary staying power that malaria has. And at each and every turn, there's an evolution that means that we have to constantly change our tools, change our approaches, stay on top of the data. So for example, parasite resistance has been evolving at each and every opportunity that we've had to introduce a new drug. And it just means that the duration of impact for these drugs that we use to treat malaria becomes shorter and shorter. And that means that we need to maintain a very rich and robust pipeline to make sure that we have new drugs coming on board as the parasite develops resistance. The other interesting thing, or challenging thing, I guess I should say, is that the mosquito has also developed resistance to the insecticides that we use. So in the past, the mosquito nets that you all sleep under when you travel, that you all sleep under in your homes, it just means that it no longer kills the mosquito in the same sort of force that it has in the past. So there's a need to constantly develop new insecticides. Finally, and this is a more recent development, the parasite actually has begun to drop the protein that we use to find it in our rapid diagnostic tests. And you all have used lateral flow assays through this entire COVID pandemic, so you understand exactly how this tool works. But basically, when we test for malaria, that parasite no longer has a protein that we use to find it. So we've had to stay in front of that with new diagnostics as well. It's constantly evolving, and it really keeps you on your toes, and just means that we need both the resources to continue to invest in innovation and discovery, and we also need the data systems in place to identify when these challenges come to the fore. So it's tricky, but thankfully there are a lot of really, really smart people working on this. So that's one aspect of the challenges that we faced even going into COVID.
And before Lady Rose tackles the funding side of things, I think a part of it we may not always think about is the conflict, particularly on the continent where it is most endemic. You know, when people have stability, they are in their homes, they have access to a form of prevention or the other, and then suddenly they have to move. And they are moving through forests, moving through all sorts of places, exposed to the weather, you know, with no access to anything. That also increases the risk. And you will notice that we've had a few of these running of recent. I also want to submit that, funding from partners is not enough. Everybody has said that. But even the amount of resources governments and individuals are able to deploy has also been at risk because of the recent economic downturn around the world. Again, like we said, the question of equity, you know, the poorer countries, people are getting poorer, poverty is affecting all of that also. And I think that is part of the reason why we may also be seeing what we're seeing.
Just to add on what both Abby and Olayinka have said, yes, it's drug resistance to nets, and conflict, migration, displaced people, refugees that are driving the epidemic at the moment. And it's at a time when funding has plateaued for malaria. There has not been an increase in funding over the last few years. And then, of course, the diversion of resources within health systems for COVID. But one thing COVID has shown us is that we have to fight these diseases globally. We can't just do it in the rich world, in the developed world. It will keep coming back. And we have to, those of us from the developed world, realize and understand that it's our obligation, but it's also in our self-interest to make sure that these diseases are eliminated right throughout the world.
Thank you very much. The mosquito, under our new strategic plan, we have 4 strategic priorities. The last one is increasing our ability to adapt. So the mosquito is also adapting, that it goes in the wardrobes and hides. It is no longer in places where it is visible. And for me, as a person who has been a Rotarian for the last 27 years, I joined when I had what they call a French cat. I had hair all over my head. Today, being a champion against malaria and against the mosquitoes, they always go for my bald head. And I suffer most wherever I go because I'm the one trying to chase them out of the continent. And in Uganda, most importantly, we are doing a lot to make sure that malaria is no more. I would like to ask Abigail, what can you do? Are you following up with how off track the world is from meeting global targets to end malaria?
It's difficult to say when you think about being on track or off track. I think anybody who's looked at the burden of disease when it comes to malaria knows that this is not going to be easy. This is not going to be something that just happens. And I think that there have been excessive challenges. I mean, we're looking at the resources, the resistance, COVID, conflict, climate change. I mean, it's actually one thing after another. And I think that we need to recognize that those challenges will persist and will continue, and we just also need to persist and we also need to continue. There are extensive learnings from polio. I mean, we've seen the incredible progress that you all have contributed to directly. It's been remarkable to see, and we're so close with polio. We are so close. So I'm going to clap to that. I don't know if somebody just clapped, but I'm clapping to that. And even in the places where we are off track, there's still significant progress that's being made. So even during the years of COVID, China, El Salvador have been both certified malaria-free. Iran is in its third year without an endemic or local case. So there's very, very good progress that's happening in places that are close to elimination. And then in the greater Mekong subregion, so Cambodia, Laos, Vietnam, Thailand, we've seen dramatic declines in burden. And those are places that were really scary for a very long time because of drug resistance. And I think there was a great fear that if we couldn't solve that problem in the greater Mekong subregion, there wasn't much hope for sub-Saharan Africa. And I think that we've proven that that is not the case. There is absolutely hope. So even though we are off track, if you look at some of the numbers, I think there's still incredible momentum and just a drive to bring in new supporters, new fundraisers, new donors, new passionate advocates for this work. So I would reframe the question as how can we continue striving forward and more rapidly instead of saying that we're entirely off track.
Thank you. Lady Rose.
Thank you, Abby, for bringing up the issue of elimination, because it is the case that we have eliminated malaria in many countries, not just in the developed world, but Sri Lanka, Iran, Malaysia are all countries that have eliminated malaria in the last couple of years. And there are a number of other countries in my region, in the Pacific, that are close to elimination. So it is possible, though we can backslide, of course, as we've also seen in the history of malaria elimination. But we have to take what's worked in those countries and see how we can apply it elsewhere. The project that the Global Fund supports in the Mekong Delta has just proven how much can be done in an area where malaria is extremely endemic. But it's taken a lot of money. It's a very big grant from the Global Fund. It's a lot of money, absolutely critical, and the lessons of it for sub-Saharan Africa are huge. But we mustn't underestimate the resources that have to be given to malaria for us to be able to eliminate it.
Lady Rose, during this time of global economic crisis, an ongoing pandemic and rising debt loads of lower income countries, where will the funding come from? And why is it important to invest in malaria now more than ever?
Thanks, Kenneth. Where the funding will come from is a very good question. This is a replenishment year for the Global Fund, and as I said, we provide 56% of all international financing for malaria throughout the world. We work very closely with the Bill and Melinda Gates Foundation, who are the biggest private sector donor to the Global Fund. And our last replenishment in 2019, we managed to raise $14 billion, which was the highest ever funding received for an international health organization. This year, our target is at least $18 billion. And it's estimated that that's what it will take for us to get back on track to the elimination goals of 2030, the Sustainable Development Goal 3, for the next 3 years only. This funding is just for a 3-year cycle. So obviously we hope that our traditional government donors, the US has already put 1/3 of the money on the table, but the way it works is that if we don't, so we have $2 billion appropriated in the US budget for 2023 with a very explicit statement that this is seen as the first installment of a $6 billion contribution to the Global Fund, which is fabulous, and thank you very much, President Biden and the US government. But the US is only allowed to give 1/3 of our funding, so we have to find the other $12 billion, otherwise we will be leaving some of that $6 billion from the US on the table, which would be a terrible, terrible shame. So, yes, of course, we're appealing to our traditional government donors. The major donors are the US, the UK, France, Germany, and Japan, and then many, many other countries also contribute. But we're also looking to a big increase from the private sector, as well as from the governments of the countries where we work. We've achieved a huge increase in health expenditure over the last 5 years in the countries where we work, but they are poor countries, and the limit, particularly with the economic downturn now, the fiscal space is very, very tight. So we hope that the private sector and organizations like Rotary, being part of the private sector, will be able to step up significantly for the replenishment this year.
Thank you very much. As Rotarians, we spend quite a lot every year to pay for volunteers, to make sure that we reach to the unreachable, and to deliver on a promise of eradicating polio. Our past Rotary International Vice President Olayinka, you have a few minutes on behalf of Rotary to share how can Rotarians show up in the fight against malaria, and Rotary, based on our perspectives, what is Rotary value add to the investment of malaria, and lastly, your role in Zone 22. How can you share the successes within malaria prevention and elimination that shows potential to scale? In a few minutes.
So many questions you want answered in a few minutes. And the first thing for me is I'm looking at the response from the Mentimeter, and Rotarians are already indicating what we should be doing, which is very much in line with what we currently do with respect to polio eradication. Rotarians raise money, Rotarians advocate, we create awareness, and we engage our governments. Let me put it this way. In one of the questions earlier, it was like, should governments prioritize resources for malaria? Majority of us said yes. But how? We know there is competition, but of course, Rotarians by our nature also have influence in these places. Governments trust us. And when we show interest, a lot of governments listen. Even the private sector listens to us because they trust us. They know we don't have any untoward interest. Let me use that word. I don't want to use the word you want me to use, but you know what I mean. Yes, we do that. So we need to step up also, because this is a major issue in our communities. And as people of action, we say we make lasting change in our world, in our communities, and in ourselves. The malaria elimination and eradication will fall squarely within that. Our communities, even for ourselves, as it were, because that is what we are actually doing. So we need to raise more money, we need to advocate, we need to influence. I remembered once, I can't remember which of the governments, there was the national budget, and somebody decided to cut off the funding for polio and even malaria and put it somewhere else, somewhere less impactful but more visible for them. And it took Rotary's intervention to say, no, you can't do this. You can't take away funding for this. And with our influence, that funding was returned. But the question to you, my dear fellow Rotarians, is this: are we paying enough attention to things like that to even be able to know where our influence is required and where we can actually make the interventions that will make the solutions we are looking for to happen. And let me say this, particularly for the current year, where we're talking about empowering girls. You know, women are more impacted by this, I believe, particularly when they are pregnant. You know, their immunities are lower and malaria does more damage. And when that happens, it affects the woman, it affects the baby. You know? So from an empowering girl's point of view, this is something we've got to do. Thank you.
I know Lady Rose is more interested in having a word in this area.
Thank you, Kenneth. And just to follow up on that point, in fact, it's pregnant women and children who bear the brunt of malaria right throughout the world. And as Kenneth said before, 80% of the 627,000 deaths in 2020 were of children under 5 years old. It's just shocking. But what can Rotarians do? And you're already doing so much. You've shown what you can do for polio. And there's also work in malaria by Rotarians all over the world. You've heard a little bit about it today, of what's been going on in Africa, and if you come to the Zambia session tomorrow, you'll hear more. I think Kenneth could speak for days about what's happening in Uganda with Rotarians. And it's not just the commitment, but the extraordinary dedication and the low cost of Rotarian programs. If you ask a public servant to deliver nets in a country, they'll be looking for their allowance, they'll be looking for their per diem, they'll travel the most expensive way. Rotarians don't do that. So if we're looking at the efficient use of money, Rotary is a fabulous organization for anyone to want to partner with. And I know this personally from a very huge malaria program that's run in my country, Papua New Guinea. Rotarians Against Malaria, PNG, are the principal recipient of the Global Fund grant and are receiving over 3 years over $40 million US to distribute nets and procure some drugs and tests. This is one of the best Global Fund programs in the world. It's recognized, we rank programs every year, and you can be A1, A2, B1, B2. They're invariably A1, A2. They just run a fabulous program, and it's become very well known right throughout the Global Fund how wonderful this program run by Rotarians is. And the government of Papua New Guinea has been forced to accept that there's no way they can compete with Rotary to do this. So Yinka is right. You do have influence over governments. We mustn't forget that. You have influence in the private sector, influence in communities, influence in churches, influence on government. It's a very powerful tool. So please, let's think more about malaria, how we can all work together to make the world malaria-free.
Thank you very much. Lady Rose, using the power of asking, I asked her, for all the good things she has done, why isn't she a Rotarian? And I told her to join Rotary. Let's put our hands together. She has accepted to join Rotary after here. Lastly, to Abigail, I'm also going to request you, being a key partner, to join Rotary, a club of your choice.
A club of my choice.
You can join the E-clubs because you move a lot, so that wherever you are, you can serve humanity as well. And the last question goes to you, in a few seconds, to talk about the innovations that the Gates Foundation has identified, such as the newly approved RTS SAS01, to make sure that a vaccine is developed and be ready for scaling all over the world where malaria is.
I have 1 minute. So what I will say is this. The RTSS vaccine, Mosquirix, is an absolutely historic achievement. This was 30 years in the making, and it's going to save a lot of lives and set the stage for further vaccines going forward. But if I could use my last 1 minute to plug an innovation that is not a true innovation, but something we should have been doing all along, it is local leadership and ownership over programs. This needs to be run from countries, contextualized solutions, female leadership driving the show, as we see with the programs that have been supported through Rotary. There will always be interesting technical solutions that are developed, but they will never get to where they need to go if there isn't country leadership. So that's my final innovation and sort of the point that I want to drive home if you take nothing else away from this. Thank you very, very much.
Thank you very much. Hasn't it been a very interesting discussion and breakout session with a lot of hope to save lives? Allow me to thank all our panelists for a job well done.
Moderating.
Let me use this opportunity to invite our Executive Director to come and have closing remarks. And I would like to request at the end our Vice President, Passport International Vice President, to pin these 2 pins to the future Rotarians.
Thank you very much, Ken, and thank you so much to our wonderful panelists. Aren't we glad to have heard from them today? So I just, again, I'm just so grateful that you were all here. I'm glad you all joined us. And if you have questions that you would like to continue to speak with our panelists about, they will be joining us in our booth immediately after this presentation. So please come to our booth. You will see it directly inside the doors of the House of Friendship. They will be here to as long as you need to answer some questions. And for those of you who are interested, again, in our small grant program, please visit our website. You will learn a lot of information about how to apply for a small grant for malaria. For our virtual visitors, if you have questions and would like to continue this conversation, please reach out to us at info@malariapartners.org. And thank you all so very much for joining us, and we'll see you at the booth.